But, of course, the big news of the day is Victor Wembanyama out for the season with a thrombosis is what they're calling it, right, which is a blood clot. And those are big words as far as I'm concerned. So we had to go find an expert, and we have got one of the very best. That is for sure. Joining us now on the Buyers Barricades guest line is Dr. Josh Bell with the Sports Institute at TSAOG Orthopaedics. Dr. Bell, I hope you're staying warm and enjoying this Thursday.
Yeah, it's a cold day out here. It's a cold day and not good news for the Spurs in San Antonio today for sure.
Boy, that is for sure. I tell you what, everybody's been a little bit down, Doc, and it's and I think it's really because of the unknown, right? We really don't know exactly what we're dealing with here, although it seems like things aren't maybe as bad as they could be. But the first thing you can explain to us is, what is vein thrombosis?
It's basically a blood clot, and so the blood clots that happen, basically, you've got the high pressure system of your circulatory system, and that's the arteries, and then the low pressure system, that's the valves. So the the veins that bring it back through bring the blood back to the heart. So that lower pressure system, sometimes for different reasons, we deal with it sometimes after surgery, someone can get, a blood clot, which is just blood that coagulates inside the vessel of the veins. And that's essentially what he's dealing with. And it's in his shoulder, which is a little less common than the lower legs. We see that a little more commonly, but that's what he's got. It's blood that's coagulated inside the vein that's just not flowing right now area.
So what's the best treatment for that? What are they doing with Wemby now, do you think, moving forward? How do they treat this thing?
Yeah, for sure. What happens whenever a blood clot happens, we have to put them on blood thinners, and that helps dissolve the clot over time. And so he'll definitely be on blood thinners for amount of time based on the blood clot, and that might be months. And so when you're on those medications, obviously you're at a risk to have more bleeding because you're on a medicine that thins the blood. So that's why you can't do things that might cause trauma or fall or things like that, just because it's riskier because your blood's thinner with those medications.
We're visiting with Dr. Josh Bell at Sports Institute at TSAOG Orthopaedics. And Dr. Bell, I got to ask this because Wemby, he missed a couple of games with what the Spurs called illness. And then yesterday he was on the injury report as doubtful for tonight's game with an illness. And then we get this news today. How do you know, or how does a doctor know that you might have a blood clot? Are there symptoms that Wemby had that would tell you that could be it?
Yeah, I mean, I would say a blood clot in the arm, it's not a super common thing for us to see. So like I was saying earlier, we usually see this as an orthopedic surgeon after a surgery. And that's because, they've had a trauma from the surgery, or maybe they had a fracture and that was the trauma. And then they're not moving their leg or their arm as much because they're recovering from the surgery. So we see it, and the way we, kind of get suspicious about it is some swelling or some extra pain or things like that. When these happen and we just don't have a great explanation for them, a patient might complain of some soreness or some swelling or some other things. And then we do an investigation to find out. You could get an MRI, but usually for this, you would get an ultrasound to look at those veins to see if there's a blood clot, or sometimes they get a CT scan just to look at those. But usually for something like this, that's not a common thing. You don't hear about it in the NBA very often. So they must have had some suspicion. He must have had some kind of symptoms in the upper arm. And that's when they said, well, let's investigate this a little more. And I don't know if they got an ultrasound or a CT, but those would be two of the more common ways we find the diagnosis.
Well, Dr. Bell, having said all of that, now that they found it, they know exactly what it is, and we've talked about the blood thinners and all that. Is this something that Spurs doctors, or you, if Wemby was your patient, would you check it on a regular basis? I mean, is this something you need to look at once a week, every day? What do you do?
Yeah, no, you don't need to look at the clot every day. What usually the main thing out for a patient in this situation is you'd want to find out why it happened. And so, like we said, it sometimes happens after surgery. We usually will consult a specialist like a hematologist a doctor that looks at the blood in those specific instances to see, is there a reason that this person got this blood clot? There could be some structural reasons, like a difference in his veins. There could be a reason, metabolically for having these. So we'd investigate that. We want to know why it happened so that we can say, hey, it's not likely to happen again, or we can really look at overall, whether he's at risk to have other clots. Because really, the main thing you worry about, and one of the reasons you put them on blood thinners, is to dissolve that clot, but you wouldn't want it to get bigger or to go to other places, because it could potentially, it's very rare, especially if you're treating them, for the blood clot to go to the lungs, and that's called the embolism. That's the thing we really worry about. Those are dangerous. They're pretty rare in this instance, and they're really rare if you're treating it properly.
Well, no question about it. Dr. Josh Bell, I tell you, this thing, it scared the heck out of everybody. Obviously, when you're hearing blood clot and with all the things that you just said, everybody was obviously concerned. And now that Wemby's going to miss the remainder of the season, and I know you haven't looked at him or checked him out, but typically, and you say it happens a lot after surgery, typically, when is a patient up and about and being able to do normal things?
Yeah, I mean, again, you would likely be on blood thinners for at least a couple of months, 2-3 months. Sometimes we'll rescan to see if the blood clot has cleared, and then really it's a matter of really looking at all the factors as to why it happened. Is it trauma? Is it something else? So they'll be I'm sure they would do an investigation. That's what you would do with any patient, is try to find out. Like I said, usually in my situation, they don't happen very often, but when they happen, for us, it usually happens after a surgery or after a big trauma. So we have an explanation, like, oh, they had a trauma, that's why it caused this issue, or they just had a surgery, or they've been really inactive for a little while, and that's the reason. So anyway, that investigation is important to find out or have an explanation for why it happened. The treatment is at least months on the blood thinners, and then they reevaluate to see, based on all those other factors, other evidence that they've uncovered during their investigation, to say, hey, he needs to be on it longer, or he can be off it, or that's really where they make those plans later on once they know more information.
Well, Dr. Josh Bell, the best in the business. That's why we called you, sir. We appreciate your time this afternoon.
Hey, thanks so much for having me on.
Absolutely. Appreciate it. Dr. Josh Bell, the Sports Institute at TSAOG Orthopaedics.